Hello, my name is Abigail Schaefer, and I am here today to talk to you about living with a skin condition and mental health struggles. I am 17 years old, soon to be 18, and I live in Nemo, South Dakota. I was born with Netherton Syndrome, and I also have an older brother that was born with the same condition. I am here today to share my story and my journey not only with Netherton's, but also with my personal mental health struggles. Living with a rare skin condition has not always been easy. However, I had an advantage in dealing with Netherton's because my family has a history of the disease. My mom, along with one of my aunts, has the condition, and they both grew up in a family of medical professionals, so they always had the proper care and support for their condition. Because of my Nethertons, I was at a greater risk of developing food allergies. I am allergic to almost all of the most common food allergies, although some of them I obtained from genes. And just like with my skin condition, my parents knew how to properly care for my allergies to keep me safe. In addition to having Nethertons, I was born with a congenital heart defect. I had surgery to correct a coarctation of my aorta when I was just a few weeks old. Because of this, I had to spend a few months in the NICU. It was a long and difficult journey for my parents to go through, and even after surgery, I had to have years of physical, speech, and occupational therapy to gain my strength back and develop properly, but I grew stronger, and today I only have to have yearly checkups with a cardiologist to make sure that my heart is working properly. My parents always treated me and my brother like any other child. They told us that we were not different and did everything to ensure that our childhood was normal. We go on several family vacations together. We have been to Mexico several times, and we have also been to Belize once together as a family. My parents love going outdoors, so we love to go hiking, biking, kayaking, and skiing. In addition to these hobbies, I also enjoy art, drawing, and reading. When I was old enough to go to school, I felt comfortable being around children my age. Elementary school was not much of a struggle for me. While I did encounter some younger kids calling me names, I didn't necessarily experience bullying. I just liked being a normal kid, and I didn't care about what anybody thought of me. I had a close group of friends that I hung out with when I was younger, and they accepted me for who I was. I switched schools when I was in fourth grade because my parents felt that me and my brother were not getting the proper education that we needed at my older school. And at this school, I befriended another group of girls, and just like the last group, they were very friendly and welcoming. They accepted me for who I was and didn't treat me like I was different. I stuck with this friend group throughout middle school also, and I did feel like our friendship was growing. High school, however, was a different story. When I was a freshman, we were coming out of the pandemic, and I came back to school after doing virtual learning during my last year of middle school. When I entered high school, it seemed like everybody changed. It seemed like high school friendships were now all about cliques, popularity, and appearances. I felt alone because I didn't fit in anymore with school. This is when I started to realize that my friends weren't actually the people that I wanted to hang out with. I felt like my whole friend group was becoming more popular while I was left in the dark because I didn't meet their expectations. School was no longer a safe and comfortable place for me. I felt scared and very vulnerable. I enjoyed the learning aspect of school. I didn't have any trouble in academics. I was a straight A student all throughout high school. I also enjoyed extracurricular activities. I continued playing the flute in band, which I started when I was in sixth grade, and I became a member of my school's marching band when I was a sophomore. I also took part in a one-act play at my school, which was the very first time that I have ever been in a play on stage, and it was a great experience. It was only the social aspect of school that I really struggled with. I am a shy person to begin with, so I had trouble making friends from the start, but high school took my socialization struggles to a whole new level. My freshman year of high school is when my mental health journey began. I first sought help through my school counselor. I was uncomfortable with her, so my mom decided to get me help through therapists outside of the school. I met with my very first counselor for a couple of sessions, but I soon figured out that she wasn't the right fit for me. My mom started searching for other therapists that might be better for me. It was a long and difficult journey that involved many trials and errors with several therapists. And then in my sophomore year at school, I started seeing the school psychiatrist. However, things didn't get any better in my sophomore year, and they sometimes seemed like they were getting even worse. I didn't have anyone to talk to at school, and I sat by myself at lunchtime. I wasn't friends with my old friend group anymore, and it seemed like they were just avoiding me. So I tried to become friendly with some of the other friend groups at my school, but I didn't feel like I belonged to any of them. And after several sessions with the school psychiatrist, I wasn't feeling comfortable with her anymore. Last summer, I worked at a Boy Scout camp in my area. It was one of the best experiences I have ever had. It was a total opposite environment from school. Everybody was very welcoming, and for the first time, I felt like I truly fit in. I felt happy for the first time in a while because I wasn't anxious and depressed. I also met several new friends there that I still keep in touch with. After camp, however, I had to go back home, and I started feeling like I did before. I got anxious and depressed again. I think it was just difficult for me to get back to reality after having so much fun working at camp. I started seeing a professional psychiatrist, and she recommended that I should take medication. And I also finally found another therapist that I was comfortable with after having to go through that journey all over again. So during my junior year of high school, my mom insisted that I do online school because she wasn't comfortable sending me to school again. And during online school, I kept in touch with the friends that I met at Boy Scout camp. I also volunteered at several organizations in my area, including Feeding South Dakota, Special Olympics, and my local Humane Society. Volunteering allowed me to help and give back to my community. It made me feel like I had a sense of purpose, and I felt happy doing it. Volunteering with the Special Olympics was one of the best volunteering experiences I have ever had because I felt like I truly fit in with the organization. I believe that I could relate more toward people who have disabilities because I share some of the same experiences with them. This is when I finally started feeling a little bit better because I didn't have the added stress from dealing with people at school. So this is where I get into the main part of my presentation on chronic disease and mental health. So firstly, a chronic disease is a long-lasting, sometimes permanent condition that requires medical attention and may limit daily activities, while skin conditions such as ichthyosis are the main chronic diseases that I am discussing. There are numerous other chronic diseases out there such as diabetes and epilepsy. There is a link between chronic diseases and mental health. People who have chronic diseases are more likely to develop mental health problems than those without chronic diseases. In addition, mental health issues can even lead to some chronic diseases, as people with depression or anxiety are at a greater risk of developing these diseases. So the first thing that you need to ask yourself is, how do I know if I have a mental illness? So mental illnesses affect our thinking, emotions, and behaviors. They can be influenced by our environment, trauma, family and friends, and even genetics, as some people have a family history of certain mental disorders. If something feels off or wrong, you may want to ask yourself these 4 questions. And in addition to asking yourself these questions, it's also important to learn about what type of mental illness you may have. There's a difference between if you are just sad or if you are depressed, and also if you are just stressed or if you have anxiety. The telltale sign that you may have a mental illness is if it lasts a long time, at least a year or more. There are numerous types of mental disorders, and certain mental diseases fall under the different types of mental disorders. Mood and anxiety disorders tend to be the most common. Others include eating disorders such as anorexia, personality disorders, and psychotic disorders such as schizophrenia. It may be difficult to pinpoint the exact mental disease that you associate with, so talking to a doctor is very important in diagnosing a mental disorder. So then you need to figure out, which mental illness do I have? If you are feeling any of the symptoms that might indicate that you have a mental illness, and if you answered yes to any of the questions on the previous slide, you may want to take an online mental health test. And on the screen is just one example of that. There are numerous others out there, but you want to be sure that you are taking a test through a reliable health source. And you can also do some research to find diseases that match the specific symptoms that you are experiencing. The next step is to consult with your doctor or therapist to get a proper diagnosis. Diagnosis can take a long time, and it may be confusing because some mental illnesses share the same signs and symptoms. Getting properly diagnosed will allow you to seek the appropriate treatment and medications for your specific illness. And just remember that a diagnosis does not define you. It's just a way of connecting you with the help that you need. So I will be discussing 2 mental health diseases. The first one is depression, which is one of the most commonly diagnosed mental disorders. It is described as a group of conditions that involve the elevation or lowering of a person's mood. The difference between sadness and depression can be confusing, but depression typically lasts longer than sadness, and it may interfere with daily activities. There are several types of depression, a few of which include seasonal affective disorder and bipolar disorder. And on the slide, there is a list of symptoms associated with depression, including hopelessness, anxiety, and difficulty sleeping. Anxiety is the second mental disease that I will be discussing. It is another commonly diagnosed mental disorder. It is described as a mental disorder characterized by excessive and persistent worrying, nervousness, or unease. Anxiety is an emotion, but it may become moderate or severe enough to develop into a disorder. Anxiety disorders typically last longer than just the anxiety emotion, and they may be spurred by specific events or situations that make someone nervous. Types of anxiety include social anxiety, panic disorder, OCD or obsessive compulsive disorder, and PTSD or post-traumatic stress disorder. Specific phobias may also be classified as an anxiety disorder. And on the slide, there is a list of signs and symptoms commonly associated with anxiety, such as nervousness, excessive worrying, or difficulty concentrating. However, you may experience physical changes with anxiety, such as an increased heart rate and blood pressure, rapid breathing, or excessive sweating. Some other common symptoms of anxiety may include fidgeting and restlessness. You may notice that many of these symptoms are similar to the ones associated with depression. However, depression is most often associated with sadness and tiredness, while anxiety may cause a person to be more energized and worried. You can even have both anxiety and depression at the same time. Mental health is just as important as physical health. So just like you need treatment for a physical illness, you should also seek treatment for a mental illness. There are many types of treatment options out there for mental health. You can get medical assistance along with personal treatment options. So the first treatment option is lifestyle changes, which are things that you can do on your own to treat your mental illness. These changes may include sleeping well, eating healthy, and exercising daily. However, you can also try calming activities such as yoga and meditation to control your thoughts and feelings. Even just practicing your hobbies and hanging out with family and friends are good treatment options, as both of them can help distract you from the feelings associated with mental illness. The second treatment option is therapy. There are numerous types of therapy options for you to choose from. If you are not comfortable with one form of therapy, you can always try another. Cognitive behavioral therapy tends to be the most common form of therapy. It involves social intervention that aims to ultimately reduce or eliminate symptoms of mental health disorders. Group and family therapy are also available if you are uncomfortable with one-on-one intervention. Psychoeducation, another type of therapy, is a combination of cognitive behavioral therapy, group therapy, and education. It aims to educate the individual about the certain mental illness they may have and how to control it. In addition to art and interpersonal therapy, humanistic and holistic therapy also exist. Online options for therapy are available, which offers a great alternative for someone who is not comfortable with talking to a therapist in person. Before I started therapy, I didn't want to do it because I was worried about what other people might think of me if they knew I was in therapy. But when I go through therapy, it's really helpful. It's like a way of connecting your mind and your thoughts and your emotions and how to control it. It doesn't have to be a big commitment. I only seek therapy at least once a week, only an hour a session, and you can even spread it out further than that. But the most important thing is to make sure that you are comfortable with your therapist, because if you're not, then the therapy is not effective because you are not being totally honest with your therapist. And you need to make sure that you get another therapist that you feel comfortable with right away. So medications are a third treatment option. There are several types of medications out there to treat and reduce symptoms of mental illnesses. However, medications are usually used as a last resort, and it is crucial to continue therapy while taking medications. Medications may affect everyone differently. Some people may find medication beneficial, while others may not experience any changes. In addition, you may need to take multiple medications at once to target different symptoms. Medications may be a trial and error process. Some may not work, so you may need to try a different one. In addition, some medications may take longer to set in and take effect. Some medications may take between 1 to 2 weeks to be effective, while others may not take effect until even anywhere between 6 to 8 weeks. So support, not just from your therapist and medical professionals, but also from your friends and family, is a very important aspect of recovering from mental illness. Don't be afraid to talk to your friends and family about how you feel, as they may be able to help you find the appropriate medical assistance and therapy to help with your symptoms. School teachers and classmates are also some great people to talk to and gain support from. The most important thing that you need to realize is that you are not alone in this journey. There are hundreds, probably thousands of other people out there that are going through the same thing that you are. It is okay not to feel okay, but getting the proper support from your peers is crucial to recovery. So here are several organizations involved in mental health for assistance and support. The Suicide Prevention Lifeline offers 24/7 support by text or phone call for anyone who is struggling with suicidal thoughts. BetterHelp is an online platform that connects you to a therapist and offers mental health assistance. Active Minds and You Matter are both mental health organizations that particularly focus on assistance for youth and young adults struggling with mental illness. And Not Okay is a free app that provides immediate support for someone with a mental illness. There are numerous other organizations in addition to these that deal with mental health. Feel free to reach out to any of them if you are struggling and need assistance. In addition, assistance and support from medical professionals and your family is also very important. So, to wrap up my story, today I seek regular counseling at least once a week, along with taking medications to control my anxiety. It took me a while to find the right medication for me, as some of them made me feel even more anxious than I was before, but I am feeling much better than I was last year. I am not at 100% yet, and it is probably going to be a while until I do, but I am making sure that I stay hopeful and optimistic about the future. After I graduate high school, I am planning on going to college to study pre-med. My parents are originally from Pennsylvania and they are planning to move back there soon, so I am actually planning on attending college somewhere in Pennsylvania. I want to be a doctor because I want to help and inspire people that are like me. I think my whole journey of living with a rare skin condition and a heart disorder, and also having several relatives that are medical professionals inspired me to pursue this career. Throughout my journey, I realized that mental health involves a lot of patience. It is a long journey that needs proper support and assistance in order to recover. You are not alone in this journey, and there is help out there. If you are struggling and have any signs or symptoms of a mental illness, please reach out to your friends and family and start getting medical assistance as soon as possible. It is better to start treating your symptoms sooner rather than later. You need to be optimistic in order to get through this journey with the right help, and just remember that there is hope. I would like to thank all of you for my time and support. I hope that you found this presentation helpful and relatable, and I hope that it encourages you to seek help if you are struggling, or if it encourages you to allow others to seek help. I would like to thank first for giving me this incredible opportunity to share my story and get involved in the organization, and also connect me with people who have the same condition as me. I would also like to thank my medical team, Dr. Wittenberg, Dr. Fromm, and Dr. Erickson, for taking care of me throughout my life and providing assistance on how to properly treat my medical conditions. I would also like to thank my pediatrician, Dr. Farnsworth, and my counselor, Erin Adkins, for guiding me through this journey to recovery. Lastly, I would like to thank my teacher, Mrs. Leitenberg, my parents, and my brother for being the greatest supporters through this journey and for being there whenever I need them.